LeBron James' oldest son, Bronny James, still recovering at home now after suffering cardiac arrest while playing basketball at the University of Southern California earlier this week. He spent 3 days in the hospital. Joining us to talk more about cardiac arrest in youth sports is Dr. Eli Friedman, medical and sports cardiologist at Baptist Health. Good morning, Dr. Friedman. Thanks for joining us.
Good morning. Thank you so much for having me.
Yeah, a lot of people are talking about this, but I want to start first with the difference between cardiac arrest and a heart attack. Can you explain that a little bit?
Yeah, fantastic question. I appreciate the opportunity to talk about it. So a heart attack is when there is blood flow that stops or is severely limited within the flow of an artery of the heart. If left untreated, that can lead to cardiac arrest. It is a medical emergency, but it is not synonymous with cardiac arrest. Cardiac arrest is when the heart enters into a very dangerous rhythm or starts beating altogether entirely. It is absolutely in a medical emergency, and if it's not treated, it will ultimately lead to death.
And what sort of things can cause this? You know, it's something that we're certainly talking about a lot more after Damar Hamlin and Bronny James. What are some things that typically cause this?
So it may be somewhat disconcerting, but the most common cause of this cardiac arrest in athletes is actually sudden and unexplained death. And that means that if somebody had an electrocardiogram, an echocardiogram, perhaps an autopsy, that everything was completely normal and there's no obvious cause. So that may be hard to conceptualize, but that is the number one reason. Moving beyond that, though, other things that can do it are structural heart disease, so problems with the heart's muscle or valves. There can be problems with how the arteries of the heart form. There can be electrical abnormalities or then even acquired abnormalities of the heart. So things like myocarditis can do this, and then temperature, heat, and then a whole host of other causes actually that have nothing to do with the heart. But most common cause, sudden and unexplained death.
And I'm sure it's different for all patients, but what does the recovery look like?
Yeah, I do think it is different for each and every individual. I think it depends on what the etiology of it, why did it happen, what's the treatment of it. And, some people can absolutely return to sports and continue to play healthily and safely with expert oversight. Some, unfortunately, have to retire. So it really is variable depending on why it happened.
Yeah, and we're entering into a new school year here in the next few weeks. Youth sports are so big here in South Florida. I'm sure a lot of parents are watching and they're worried about protecting their kid when they head back to the classroom. Can you tell me how parents can minimize the risk of their kid suffering cardiac arrest?
So the most important thing is to definitely meet with your pediatrician or whomever your healthcare provider is and have that annual physical exam, the history and the physical. That's a great way to uncover anything that may be there. Knowing your family history is really important. So if there's genetic heart disease in the family, if people have died suddenly with unexplained reasons, that could be a marker for pathology as well. We hear a lot about the electrocardiogram debate. Should kids be getting electrocardiograms to screen for this? We don't recommend that on a mass level that every single person should have one, but it can absolutely be part of shared decision making along with your healthcare provider. And then without a doubt, if there are symptoms, so unexplained chest discomfort, abnormal breathing, skipping or racing heartbeats, fainting, especially during exercise, and then again, that family history, it's absolutely worthwhile to make sure that we're getting checked and make sure that the heart and cardiovascular system are safe.
All right, Dr. Eli Friedman there. Thank you so much. Great advice. We appreciate it. We will have all of this information.